I'm mic'd up, and my four collaborators are not. This is Amy Frunks, and I'll ask Amy to introduce herself first of all.
So yeah, my name's Amy. I'm a member of NHS England's Youth Forum, and I'm also a service user, a young person.
A young person, great. Katie, do you want to introduce yourself?
I'm not so young. My name's Katie. I'm a service user, and I'm also the lead governor at an NHS Foundation Trust in Liverpool.
Sean, would you introduce yourself?
My name is Charlotte. I'm an international project worker for Change.
And Tommy.
Hi, my name is Tommy Whitelaw, and I work on a project called Dementia Carer Voices, and I was a full-time carer for my beautiful mum, Joan.
Okay, so we have no agreed order. Would you be comfortable kicking off, Amy?
Yeah, that's
fine. So I think everybody who's on the panel has been asked to think about what they want to say in answer to some questions. And the first one, I think instead of me asking each one all three questions, essentially what I would like to know is what patient feedback means to you, what you think the NHS should be doing with patient feedback, and what you'd like to see them do.
Okay, so I think for me, actually, what does feedback mean? Well, feedback means an opportunity for individuals' thoughts to actually be validated and acted on. And feedback has to be taken, it can't be taken in a tokenistic approach. So when you're asked for feedback, if you're just told, tell me a bit about the service or something, then actually you're not going to get that meaningful insight that's needed. Feedback has to be with a vision in sight of actually what is going to happen to it. So when asked, can I have some feedback, being a young person, being a carer, family, anything, actually you want to know what is going to happen. And if you know that that feedback is going to be fed in to something very important, your views are actually going to be listened to, you're more likely then to be able to deliver an insight that has more value and means a lot more, and that can actually develop a service for many other people. So actually, when asking for feedback, it is that this is what we're going to do, and it needs to be inclusive of everyone. And I think quite often, as hard-to-reach groups or whatever they may be, and as young people, our feedback can sometimes be forgotten. And I mean, from my experience with the NHS, I've never been asked for feedback on any of my services. Once I had a conversation with a matron, but that was about it. So it's actually having those opportunities and time to collect qualitative as well as quantitative data.
So is there anything different about being a young person, would you say, Amy, about the way that you want to be asked for feedback from any of the ways that perhaps have been conventionally done?
I think for me at my age, I just want to be asked for feedback like any other person. I want to be treated as an adult and talked to as an adult. But it's making sure that it's approachable to meet whatever that person's needs are. And if that's changing the format of the question, well, it's changing the format, and it's not being so linear and strict and saying, right, tick a box. It's saying, so what do you think? What actually matters to you? And collecting some data in a different way.
So one of the things I hear is that people your age want to give feedback digitally because you all talk to each other digitally, much more than people my age, for example. Would that be true, do you think?
Yeah, I think to a certain extent, but obviously if you're doing everything digitally, you can sometimes lose the meaningful aspect of patient feedback. In some ways it's having a two-way conversation, being able and develop that conversation, which actually social media can be slightly challenging, but it is a fab way to reach many more people.
Mm-hmm. Okay. Katie, can we ask you next to reflect on the same questions? What does feedback mean to you? What do you feel about the way the NHS collects it? What more could be done that would be better than what's happening now?
I think as someone who's in and out of many different trusts regularly with different conditions, I'm in and out of different environments all the time, Nobody ever captures that full 360 picture. Nobody ever tries to understand. They maybe look at their ward or the A&E experience, or been asked for feedback from EMAS, the ambulance service, but no one ever looks at the bigger picture, and that's where sometimes actually I see the most problems, because that's where my journey becomes halted at times, because appointments aren't locked together and don't make sense. I think patient feedback is incredibly important, because I think your example about the oil rigs really resonated with me. It's actually patients who would see that tiny little leak before anyone else did. And before you know it, the NHS is dealing with the oil rig exploding. We saw the little leak before it happened. And I think patients aren't given enough credit. And actually, every single person in this room is a patient. I mean, I know it takes a personal experience, like those two last ones there, for doctors in those examples to realise what it's like to be a patient. We're all patients, and we've all got an insight about what it would be like if that was me waiting 6 hours for a hospital bed, or if that was our mother or our child. So I think people need to think about it from a slightly different perspective as well. Patients are asked for feedback as they're moving through the system, which is important, because in that moment is when you need to give the feedback. Because when the moment's gone and you're home and your family member is safe, you don't really care that the food was rubbish. But in that moment, it's really important. But actually, everybody should be contributing. Everybody should have something to say about the NHS, because it's their NHS as well as the patient lying in the bed. I think how we can get better. I actually couldn't sleep last night and read a thread on a support group for one of the conditions I have. And they were raving about the hospital that I'm the governor at. And I said, has anybody fed this back to the hospital? And they all said, oh no, we wouldn't know how. And I think sometimes patients have got a lot to say, but it's not obvious how to do that.
So, you are a governor.
Yes.
In this organisation. What can you do to help the organisation to connect into those sorts of threads in a way that would be useful, do you think?
Making it more visible, I suppose. I mean, I follow my hospitals. I sound like such a stalker. All my hospitals on things like Twitter and Facebook, because that's where I get all the information. But I have walked through every single one of these hospitals, never seen any visibility of a Facebook page or a Twitter thing that you can go to, and in that moment, sat in A&E, tweet them and say, do you know that it says that this is going to happen and it hasn't? And it's really easy to give feedback that way, and it's qualitative feedback. It's in the moment when you really are experiencing it, and that's the really important feedback. But people don't know how to give feedback outside of the very vague ticker box.
Okay, so we might come back to that. Okay, Sean, would you like to answer the same questions? So, what does patient feedback mean to you? And what do you think about the way that the NHS, the way that you've experienced NHS organisations asking you for feedback?
I go to hospital quite a lot because of my diabetes, asthma and other issues. It can be a difficult experience, like going to the hospital. When I go, and I find it quite stressful, because when the local one I go to is a very big hospital. It's like going around a maze.
Yes.
And it's really when I go, I'm a very independent person. I've got learning disabilities. I like to do things for myself. I went to the hospital last time and I got lost.
Yeah.
And I missed my appointment. Yeah. And I thought, very small. I wasn't too impressed because nobody really departed me. No staff really departed me.
No.
The signs, it were not very accessible. It colour lines, but I don't know where they went. It was just like very confusing experience for me.
Yeah.
And I had another appointment. My mother came with me. I didn't like to take my mum with me, but I had no other option. I went there an hour earlier to make sure I not miss my appointment. And me and my mother will find it. We got confident we'll find it. And like 50 minutes later, we still couldn't find it where we were going. It was for my diabetes checkup. We were going to the clinic. My mum was starting to get a bit annoyed because they asked the staff where we were going. My mum is a very patient person, but she was starting to... She wanted a happy buddy. and we... it was just my mum kept looking at the time. It was getting quite stressful for me and my mother. And in the end, we had to staff. We didn't even know where we were going.
No.
In the end, we had to ask a patient where to go. We had to follow the patient. And we just made it 5 minutes before. And that was just really, really not very good. And I asked for feedback after all that lot. I couldn't find any feedback. I couldn't get any feedback at all. It was nothing on the desk, put a complaint in or anything.
Have you ever been asked for feedback?
I asked about it. Nobody asked me nothing.
Nobody's ever asked you?
I got no letters or telephone calls, no feedback. Or I even looked for a complaint form because the service I got from the staff was not very good.
Yeah.
And earlier on today, you'll talk about patient experience.
Yes.
And you'll talk about putting a complaint in. It was very low. My experience was it was very, very stressful.
Could you say how you would like to be asked to give feedback? Would it have been, I mean, after the stress of what you went through to get to the appointment, would you have wanted to give feedback at the appointment, or would you have preferred to give it later, do you think?
I'd like to have the feedback after I have the appointment.
After it?
And then I know what, and then I'm more a bit calmer.
Yeah.
But the feedback needs to be in an accessible way.
Yes. And would you like to do that? Would you like somebody to ask you or to phone you rather than to write it down?
I find writing very difficult. Maybe a phone call, or maybe I'm good on mobile phone texting.
Right.
Find different options to talk to people.
Right.
Is a way to ask for feedback.
Yeah.
I went again a month later for my feet. It was a different experience. I was very anxious again, but this time the volunteer person and the staff member on the desk, I told them I can't read and write very well, and I told them I'd like going to a maze, and they took me to the appointment. I thought better about that because they understand what I was talking about.
And did they?
And I told them, yeah.
Yeah.
Some people with disability like me or without no disability do get lost, and they'll be showing people where to go. It's not very good.
No. Would you mind giving the microphone to Tommy, and then we can hear from him, and then see if we've got time for to pick things up across the panel.
I think there's been quite a lot said already that I kind of agree with, but I think what does feedback mean? I think it's important. Every single one of us walked in this room with a unique and remarkable story to tell. Every one of us walked through with a story, and everyone we meet and work beside and we care for has a unique and remarkable story to tell. And feedback back should really be based on how we collect and listen to those stories. And I know we were speaking earlier, and I tweet it every day about changing that conversation from what's the matter with you to what matters to you. But I think it's more than that. I think we have to also ask who matters to you. I think that's the key to it. It doesn't just become another hashtag or another saying, but if we're really going to ask people about feedback, it has to be based on what matters to you. and who matters to you and what kind of information do you need. And I think we have chances to collect feedback every single day. The incredible thing about the NHS and everything connected is it's built on people and it's built on relationships. And every single day we have an opportunity to get to know people better and be part of their relationships. And in the little campaign that I started from my bedroom when I was caring for my mum, I asked for feedback in a different way. I asked people then, 4 years ago, what mattered to them. I told them just how I felt, what it felt like to be a son caring for his mum, what made us smile and what made us cry and what made us feel safe or made us feel scared. And the word that appeared in every single letter in the thousands and thousands and thousands of letters I've received is love. It appeared. It's a love for a husband, a wife, a mum, a dad, or a son or a daughter. When was the last time we spoke about things like that in any form of feedback? Because that's what matters to every single one of us. Every one of us has a unique and remarkable love and life story to tell. And if we're really going to be serious about what feedback means and how we collect it and how we use it and how we listen to it, it has to be based on the remarkable life stories of the people that we're asking. And every single day, the people in this room are in a unique and remarkable position to stand next to remarkable people and play their part in their love stories and their life stories. And I think it also goes back behind that. Absolutely, we have to change the conversation to what matters to you. But we also have to ask every single person who works across the NHS what matters to them. If we start off by asking what matters to them, it will make that conversation an easier and a better conversation to have to the people we care for. So I think we have to, data, feedback, all these words. I prefer life and love stories and what matters to people. And I think you'll have better conversations and people will be more inclined to read them and more inclined to learn from them. But absolutely we have to get better at celebrating the good stuff. I think you are too hard on yourself sometimes. Get the good stuff up there, celebrate it so it inspires the next person. That's why I do this job. That's why I've done it yesterday. And that's why I'm going to get back up and do it again tomorrow. Because it really matters to the people that we do it for. And it matters to me also. So I think we have to have a real think about what does feedback mean? What does data mean? And what do those conversations look like? But more importantly, what do they feel like? And that's some of the things I'd like to. I've tried to answer 3 questions in once, but we'll see how that goes.
Thank you very much. I think there's a number of things that each of you have said which we should just try and pull out a bit. But just to start with that one that you were just saying, Tommy, about celebrations. And on that slide where I was putting up all of the kind of objections that staff make to getting engaged with patients and with feedback from them. One of the things was fear. And so I think that many people who work on the front line expect that when they hear patient feedback, they hear criticism and they hear complaint rather than celebration or gratitude or positive things. And I think that we should be emphasising much more than we do how very much people appreciate the services that they get, and in the sort of way that you're describing, which is about the connection between human beings. How powerfully people feel that and say so. And I think if clinical staff understood that more, the barriers to engaging with patients' feedback might come down a bit. But I just wanted to pick up a couple of things that different people have said. One was about volunteers. You were saying, Sean, about how valuable volunteers can be. And the other was about groups somehow, this idea of conversation threads and patient groups. In your group, Tommy, that you had, that were talking to each other. And I wondered whether... So I'm trying to think about ways in which, and the other thing was you mentioned Twitter and Facebook, other ways in which people could, in this room, could feel that they were going away with some ideas or some insights into resources that are already there that they could plug into more than they do. Sean?
I think the staff at the hospital need to be trained a lot better with the patients with any type of issue about learning disabilities, disabled, anybody. Because I feel like the staff at the moment, I feel like they don't look. I'm not being nasty against the staff. I just feel like they've not got enough patience for you, and they've not got enough time with you. When me and my mum asked the staff where the diabetic clinic was, they didn't know where to. They didn't even know where to go, and I had to. I'm like, it's not really good.
Yeah.
They've been working. They must have been working for hospital for years. Why they don't know where things are?
So that's something about all the staff having that awareness
Yeah.
of helping people out when they look lost, or which I don't know that we can really involve people in the audience, but I know that Amy here from the Children's Hospital from Birmingham has got an example of a thing called a no-pass zone, which is don't go past anybody who looks like they need help without stopping and helping them. I think that might have to come out in a group rather than in this big room. But, yes, Tommy.
I was just going to say, I mean, people are a great resource, aren't they? People, we don't use people enough as a resource. We don't engage with them enough. And carers are one of the biggest untapped resources we have across the country. And by engaging and supporting and listening to them can change the dynamics for a lot of the things that we do.
And how would people know how to engage with carers, do you think?
Well, I think that's one of the starting points as well. Quite often, because one of my must-dos is nothing about me without me, because quite often people not only they saw dementia, not my mum, but they didn't see me standing beside my mum also. But I think if you look at also the numbers of carers across the UK and people who have cared in a previous life, we almost sometimes forget them when they're there and forget them after they've been caring. And it's such a resource as the NHS we could use that would help where feedback comes in as well and play a part, but also help on a daily experience and staff experience as well.
Katie?
I think where staff can really learn is where feedback is shared with staff on the spot and get staff feedback at the same time. If something's gone particularly well or something's gone poorly, not only get feedback from the patient and the carer, but get feedback from the members of staff in that moment. How did they feel? How did they feel it could have been improved? Was there anything that could have happened? Were they short-staffed? Did something happen? Because then everybody can learn from that experience. You get a full 360 view of what happened, rather than just a patient who can only really see so far. I mean, having now sat on the other side slightly, I can see a little bit more about what could have been going on. And I think it's really important that if you're going to get feedback from patients about an experience, that you get it. And the same goes for the positive things you're saying. If you had a really good experience, and these aren't just appointments, these are life-changing days. Mm-hmm. I've had more life-changing days in a hospital than I've had when I got married and things like that. It's just, these appointments mean so much. And if that doctor can get that feedback that you really handled that bad news or that good news incredibly well, then they can learn from it and they can be motivated, because I know their burden's heavy, and they can move on to the next patient with their head held high as well. So I think it's important that feedback comes from patients and staff in the same experience for learning.
Thank you. I'm going to hand over to Amy, and you can say whatever you like. You're going to have the last word.
So we've done a lot of talking about individual patient feedback, and I'm just thinking, sort of from my background as an NHS Youth Forum member, you know, it's actually also embracing collective groups. And I know that's been mentioned slightly, but you know, there is groups like NHS Youth Forum, there are small ones, and I'm sure there is some in adults or different charities and organisations. And within that, we can draw collective bits of feedback, whether it's about mental health services, whether it's about communication and things, and actually utilising those views that are there and waiting to be snapped up is a really good way to start it. And, you know, within that, there are so many pockets of good practice that exist across the country. And, you know, we have a remarkable service, which is the NHS. We want to keep the NHS. and celebrating what is there is feedback in itself. It's saying this is what can go well, and actually, you know, if something's not going well in your service, well, why don't you try and embrace aspects of this good practice, like you were saying, and actually that in itself is a constructive way to move forward.
What a brilliant way to end. Thank you, Amy. And we'll say thank you to everybody on the panel very much indeed. Thank you.